Hello, my name is Sylvia, and today I'm going to be doing a central line dressing change. As a responsible and ethical learner, I will uphold personal integrity by not engaging in any form of cheating, unauthorized collaboration, fabrication, falsification, or any other act that compromises the integrity of the skills testing recording. Okay, so I'm going to first look at my MAR and make sure that my patient is ready to have a central line dressing change. Reasons to change it would be if it's saturated or if it has been 5 to 7 days since he last had it changed. I also want to make sure that I have looked at the MAR to make sure that there is still a need for me to keep the central line in place. And since there is, because he will be needing a high volume of fluids and hemolytics, then I do want to make sure that we do the dressing change appropriately. So I'm going to come into my patient's room. I'm going to perform hand hygiene. I'm going to grab some gloves on the way in and identify my patient. Hi, Mr. Smith. My name is Sylvia, and I'm going to be doing your central line dressing change. Today, can you please verify your name and date of birth for me? Matt Smith, 10/15/1970. Perfect, that matches my MAR and my orders. Okay, Mr. Smith, so today what we will be doing is we're going to be changing your central line dressing. And can you tell me if you're allergic to any chlorhexidine, adhesive, or any other allergies I should know about? No? Okay, perfect. Do you have any questions for me? No? Okay, what we'll do is we're going to change the dressing, put on a new one, and that will be pretty much it. If you have any pain through the process or any chest pain at all, please make sure you let me know right away. I'm going to be moving the bed up to a good working height for me. And what I'm going to do is I'm going to make sure that I have all of my supplies available, okay? And then I want to make sure that that I have all of my supplies available. Okay, so what I will do is first I will ask my patient to put on a mask. And Mr. Smith, I'm gonna have you put on a mask, and this is so that we don't contaminate your insertion site, so your central line. I will put on a mask myself, and when we start the procedure, I will ask if you can please move your head over to your left shoulder since your central line is on the right side, okay? And unfortunately, just an FYI, I did not find any paper rulers, so I will be measuring with a plastic ruler. In a scenario at the hospital or anywhere else, I would make sure that it is a paper ruler that we are using. But just for the sake of the skills recording, I will be using a, so I'm going to put on my gloves. And before I remove the current dressing, I want to make sure that I have all of my supplies readily available for me to use. So I have this, my bio patch, I have my sterile kit, I have my new cap, alcohol, tape, and we are good to go. Okay, so I'm going to be using alcohol swabs to remove the current dressing. Okay, Mr. Smith, we're gonna get started. Like I said, if you have any pain whatsoever, please make sure you let me know. And here I will start from the outside to ensure that there is no dislodging of the lumen. And I want to make sure that I keep the center fully intact still because I'm not holding on to it. So just to prevent any dislocation of it. So now what I want to do is I'm going to put my finger on the bio patch just so that when I am lifting up the dressing from the outside, that it does not dislodge. And of course with this mannequins, it's very hard to remove this, but I am still keeping my finger in place. Okay. So keeping my finger in place there to prevent any dislodging. Okay. Now what I'm going to do is I'm going to measure my lumen from the chest on down, and I'm going to verify with my MAR that the measurements are fully intact and that there was no removal of the lumen or pulling out of the lumen while I remove the dressing. So now what I'm going to do is I'm going to remove my gloves. I'm going to perform hand hygiene. And my hands are kind of sweaty. So before I do that, what I want to do is, actually, I'm going to put on a new pair of gloves. I'm going to prepare my new cap and open up my sterile kit and put in bio patch and new dressing. Okay, so I'm going to open up my new cap, making sure that I am not touching it and that it remains sterile. I'm going to prime my cap and leave it in the packaging. Okay. Now I'm going to open up my sterile kit. Going to take out my sterile gloves. I'm going to throw in my new dressing. Making sure that I'm not touching anything because this field is sterile. I'm going to grab my bio patch, throw it in there. Okay. Now I can remove my gloves, perform hand hygiene, and make sure that I am ready for my sterile gloves. I'm gonna put on my sterile gloves with a sterile technique, making sure that I am not touching the outside, but my hands are super sweaty, so it's becoming a little hard to do right now. I'm maneuvering more than I should, to be honest, and they're not even in properly. But essentially right now I will fix them with the other one. In real life, I would hope my hands would not be so sweaty and I could get them in properly, but okay. So now that both of them are in, I could maneuver with them since they are both sterile. And see, this one still doesn't want to get fixed, but I will make it work. Okay, that on. I was able to put on my gloves sterilely without touching the outside of them or contaminate them. So now that I am fully sterile, I'm going to come into my kit, make sure that I arrange everything how I need to just to make sure that I have a good working space. I want to also open up my BioPatch just a bit so it's easier for it to go in. Now I'm going to grab my chlorhexidine, and now that I'm going to be starting, I'm going to designate a dirty hand. So this hand is always going to be touching my patient's chest. The minute I put it down in my patient's chest, it is considered dirty, and I will not be using it as a clean hand anymore. Only my right hand will be clean. Now what I want to do is I want to start cleaning the top, but first what I will be doing is I'm going to be pressing my chlorhexidine down where the lumen starts, letting the chlorhexidine drip down into the skin and the lumen so it can help me clean it out. So keep that down for a couple seconds. Once I see that the chlorhexidine is dripping down to the skin and the lumen, I will go ahead and just gently grab the lumen. I do not pull, I do not maneuver, I just keep my hand in there, and I'm relaxing my hand against my patient's chest to ensure that there is no movement. So I'm going to be cleaning 1, 2, 3, and now the back has already been soaked, but I also want to give it a little sweep down there. And then the lumen was already soaked also, but I also want to make sure that I'm running down my chlorhexidine, and then again down. I want to make sure that my right hand is not touching neither the patient's chest nor the lumen. So that is done. It is fully clean. Now this is dirty, so I'm going to grab my BioPatch. I'm going to insert my BioPatch, make sure it's fully set. Before putting in my BioPatch, I want to make sure that the area has fully air dried. So that is done now. Now I can definitely let go of the lumen. Again, making sure that I'm not dislodging, that I am not moving the lumen, and everything is set. Now I'm going to put my dressing on it. And I no longer have to be sterile, but I need to keep a clean technique. So I'm going to put my dressing down. Making sure that there is no bubbles and fully sealed. Okay. Now, what I want to do is there is a piece on here so I can write my name and date. So I will initial my name and then the date that I changed the dressing. And I don't want to write in the patient's chest, so I did it in the table here. And then I'm going to put it on the dressing just so that anybody who comes in can tell right away that this dressing was changed today by myself. Now what I want to do now is I'm going to make sure that the line flushes properly. So one, I want to make sure that it's locked. The lumen's locked. I'm going to grab alcohol swab, clean, oh, this is not a good thing. I cannot. Okay, I'm taking off this gloves because my hands are super sweaty. I no longer have to be sterile, but I don't know why I cannot remove that cap. One thing that I guess I could have done different is making sure that the cap was semi-loose before starting this procedure. However, it is kind of hard because we don't want to touch it and contaminate it. So, you know. Okay, I'm gonna have to grab some tweezers to remove this. 1 second. Okay, I was given some tweezers by my instructor, and I was advised that I can try this, but okay, there we go. They work. Okay, so clean it up. Grab a different alcohol wipe. Clean up the hub for 30 seconds. I have already primed my new cap. Unlock. Flush. Draw back. Flush. It's flushing perfectly fine. I don't feel any resistance, so I will go ahead and lock it again. And I'm removing my cap, my syringe. My skill is completely done. Now I can inform Mr. Smith that the procedure went well, that his dressing has been changed. I put on a new lock, and if he has any questions, he said no. Okay, we can go ahead and remove your mask now, and I'm going to pick up my supplies. And I'm going to throw away everything. And then what I want to do, I want to make sure that my patient is in a comfortable state. Also, before I do that, if the hospital, if I were in a hospital, they usually have a stat locks, right, that we can use to secure the device and make sure that it's not going to be removed. However, here we don't have that, so what I would just do is I would just grab a piece of tape, tape it down, make sure that my lumen is secure, that there is a very low possibility of dislodging. Everything's secure, checking it one more time, and I am done. I'm going to remove my gloves, perform hand hygiene, get rid of all my trash, put my patient down to the lowest position, ask if he has any questions regarding what the procedure we just did. He said no. Then what I want to do is I want to make sure that he's fully comfortable, covered, room temperature is good. I want to make sure that the phone is by his side and the call light is by his bedside, that the bed is locked. And then what I will do is I will go ahead and document the procedure. I will document how the patient tolerated the procedure, and I will document that a new cap was changed and the measurement that I got when I did the measurement from the chest to the lumen, down the lumen. And that is it. Thank you.